So this eastern brown snake is being attacked by something, and we don't know what that is, but you can see these lacerations running down the length of the body, and they're deep, you know, they're going full thickness through the skin. And here there's some tissue exposed there, which we're just about to explore once we've flushed and cleaned it up. And we see injuries like this, and more severe, all the time. It's a rare snake that we find that doesn't have existing injuries or scars from predators or trauma, accidental injury, netting, cars, dogs, cats, people with shovels. This one does seem to have a bit of a puncture there, so we're wondering whether that might be...
I think that might be an animal that's caused that?
Yeah, I suspect this is it's sort of, it's very fine, so maybe a cat, and it's all sort of scraped down it, so yeah, you can see how awful it is.
Oh, jeez. Oh,
so what we're going to do here is just clean this up a bit further, and then we're going to just debride it gently and see if we can place some sutures and closures. And they do heal. They heal really well with support and antibiotics and treatment, but you know, so many of these animals in the wild are just having to try and survive without this level of care. So I'm doing the opposite of what so many vets are doing, because most vets are treating small animals, cats and dogs, after being bitten by one of these guys. So it's pretty rare for vets to be trying to fix these guys.
Another missing tail tip, or part of the tail's come off as well.
Yeah.
Something we often see on the snake call-outs as well. So just multiple injuries can be on the same snake, basically.
So we're going to see if we can just clean up this soft tissue here. But look at this laceration, that must be so painful. And there's some bruising in there too. See that bruising and hemorrhage in there? Yeah. Oh, my level of empathy for these animals has just increased dramatically. Seeing the awful injuries that, you know, you bring into me, and see them and work really closely with them. And it's completely changed my mindset to them. They're so fragile and so shy, and they just want to get away from us, and they definitely do not deserve these awful things that happen to them. Yes, I think this piece of tissue here it's just a little bit of soft tissue that's been cut away from the body wall.
Had she not been collected by me the other day, what's the chances of her surviving the winter with these injuries?
Low, because she's got this bit of tissue hanging out that was going to become necrotic and yucco, and just, you know, eventually probably act as a tract for infection. I mean, they are amazing healers, but I think when you've got tissue exposed like that, that's really hanging, I think it's really hard for them to get over that. Okay, this is looking all like fresh, healthy tissue here now. A little bit of blood.
Great job, Dr. Lowe.
So we'll just clean it up a little bit more, and then I think I'm just going to be able to pop that back. We've flushed this a couple of times already. We should just be able to pop that in there. And like we were saying, we x-rayed this snake before we went into surgery to make sure that you know, that there wasn't an underlying spinal fracture there. The thing is that a spinal fracture isn't a good prognosis. It's a terrible prognosis, and we usually euthanize. But having said that, we are seeing animals coming into this project with fairly significant scolioses, which is basically just a bend in the spine that's fused. And it does make me wonder whether some of these animals are having these injuries and surviving them in the wild.
Wow.
But we need to do more research into that. We need more images and more research. But that's just something that we've been observing, isn't it? But you can see that these tissues start to come together pretty nicely. We'll show you another image when we're done.
And your sort of sense is that soft tissue now, it's back inside the snake's body and all sealed up, that will actually repair?
Yeah, definitely will.
Yeah, fantastic. Wow.
Yeah.
I think this is something that a lot of people don't really appreciate, is just the sort of the craft, the work, the care, and the time that goes into healing these animals when they have been harmed. And you know, often we see on social media when a snake picture surfaces, there'll be commentary about killing it and chopping its head off. And I think a lot of people don't realise that, A, that's illegal to do, B, it's completely unnecessary, C, it's dangerous, D, if they are unsuccessful in killing the animal, they'll often leave the animal with these kinds of injuries, which, if we do find the animal, then we actually then puts us a lot of extra work on us, doesn't it?
That we're spending our weekend, which is what today is,
Yes.
trying to heal these animals.
Yeah.
And it's terribly unkind for people to do that, and unnecessary when there's people around who've got the skills and expertise to just simply move these animals, or leave them be where they are. And they are so shy. Like, I cannot tell you how shy these creatures are. They just want to get away from us.
Yeah.
And they definitely don't want what's going on right now.
No.
This was not this animal's choice.
No. One remarkable feature of this project has been the prevalence of injury, either a historical one or an existing one that these animals are carrying.
We're going to treat it with some antibiotics and some fluids, and you're going to keep it nice and warm and safe. And once it's ready, we'll give it a feed. And the prognosis is really good. It's just time.
And this is where
snake's time.
Yeah.
That's a tooth. Yeah. This has definitely been an animal attack.
Yeah.
Just putting some mattress sutures in here to try and close these longitudinal wounds.
So we think that maybe been a cat's claws, maybe just ripped that open.
Yeah, cat containment is a really, really good thing. There'll be plenty of people out there who don't have cats contained, but it stops them being bitten by snakes, it stops them being run over by cars, saves you an enormous amount of money in veterinary bills. So I highly recommend cat containment.
Yeah. Treatment for anti-venom for a dog envenomation or cat envenomation, we could be talking $2,500.
Oh, easy. And they may not survive even with treatment.
No,
so so it's not a given that the treatment. Yeah, not a given. All sorts of complications from these venoms, which are with these sort of injuries from cats or other creatures. They can just be really a humongous amount of bacteria that's gone in there, and plus there's been a delay between when we've treated this and when it actually occurred. We are routinely taking bloods from all of them, and we're looking at hematology, so the red blood cells and the white blood cells that make up your blood, because there aren't normal reference ranges available for this species. So there's an enormous amount of literature on what happens to other animals when they get bitten by these guys, like massive amounts of literature, and there's nothing on what the normal is for this animal and species themselves.
And yet, such a feared animal, such a common animal, like really, key part of the urban wildlife fold and conflict, and yet we know so little about these guys.
Yeah.
We just wanted to make this video as well because we're aware that there really isn't very much out there in the public domain that kind of shows this dimension of this animal's life, and the kind of amazing work that vets like Dr. Ari do to sort of keep our wildlife going, and recirculating it. And I just think it's really great for people just to...
Thanks, Gavin. But really, it's also just so important to highlight the suffering that these creatures go through. And so you can see now there's just a couple of little puncture marks they'll close on their own. And then we've got the suture area, which looks really neat. This area here, that will heal up on its own. It's going to heal okay.
Bloods will get into that.
Yeah.
Bloods will get into that area and start to deal with the...
He's going to have a bit of a scar there, but it's going to be okay. Yeah, I'm happy with that. Okay, done. Okay. All right, we'll just get this out. Let's have the antibiotics, get some fluids for them.
Stay safe out there, buddy. Here's the amazing work Dr. Arianne Lowe's done, stitching the snake back together again. Missing tail, tip,